Hi, my name's Matt Gray. I'm a professor of clinical psychology here at the University of Wyoming. What do you research as a faculty member at the University of Wyoming? I'm a clinical psychologist by training, and the area of clinical psychology that I'm most focused on is traumatic stress. And so this is people's psychological and emotional experiences after they encounter some type of life-threatening, overwhelming, harrowing type of experience. This can be things like combat, sexual assault, domestic violence, life-threatening accident or injury, natural disaster, those types of things. And so people who study traumatic stress are interested in how people recover from those events, what kinds of coping strategies are effective, who's most at risk for developing things like post-traumatic stress disorder, and how can we best support and treat those folks. What is trauma psychology? A lot of times when people use the word trauma or they say, oh, that was really traumatic, they're talking about things that are upsetting or difficult, but not trauma in the way that clinical psychologists think about trauma. So when we think about trauma psychology, we're talking about a subdiscipline of clinical psychology. And again, we're thinking about the kinds of things that are generally outside the realm of normal human experience, are oftentimes intensely distressing, life-threatening, harrowing, again, things like combat, sexual assault, domestic violence, those sorts of things. And so people who study trauma as psychologists, we have a lot of different areas within trauma psychology. Some people look at treatment outcome, which I'm interested in. A lot of times people are interested in risk and protective factors, coping strategies, social support, other things that might help people as they recover from traumatic experiences. What is PTSD and how is it treated? Post-traumatic stress disorder is a psychological disorder that can result after exposure to a traumatic event. It is characterized by a lot of different kinds of symptoms, but some of the kind of symptoms that characterize post-traumatic stress disorder are re-experiencing symptoms. So people might have a lot of intrusive memories about that traumatic event, or they might have nightmares because those symptoms, painful memories and nightmares about the traumatic event are so difficult and so upsetting, people do something very intuitive. Unfortunately, it is also very maladaptive, and that is they will go to great lengths to try not to think about it, not talk about it, not be exposed to reminders. And as people may be familiar with, the harder you try not to think about something, actually the more likely it is you are to think about it. And so a lot of times our very attempts to cope with a trauma and the aftermath of a trauma can actually make things worse for us. People with PTSD are also likely to have changes in mood and cognition, and they're also very alert, they're very watchful, those sorts of things. And so I've already talked a little bit about kind of this interplay between re-experiencing symptoms, really intrusive memories and nightmares, and what people intuitively might try to do with that. They will try to avoid thinking about it, talking about it, encountering reminders related to the trauma, and that sometimes can prolong their difficulties. So what we try to do is empower people to be able to have those reminders, those recollections when they arise, and be able to feel like they're in control of them better and they're not going to be overwhelmed by those types of memories. The other thing that we do when we treat post-traumatic stress disorder is look at changes in beliefs and thoughts about the world and the trustworthiness of others and ourselves, and try to maybe correct some beliefs that have gotten to be pretty extreme after a traumatic event. And those are kind of the main approaches that we use. What is the psychology behind trauma? Trying to study what coping strategies are going to be helpful and what are going to be unhelpful after exposure to a traumatic event. It might be studying how we can prevent certain types of traumatic events like sexual assault and domestic violence, identifying risk and protective factors, like if you have a trauma, who's more or less likely to develop PTSD. So that's sort of the psychological science behind trauma. How does trauma impact us, and why do some people have greater difficulties than others? but serves us well in a survival sense might not serve us well emotionally or psychologically. And so after a life-threatening event occurs, after something really horrible or awful happens, it's not uncommon for people to have sort of an evolved response where they are going to be super alert to future threat, future danger. They're going to be hypervigilant. They're going to be like worried about danger around every corner. And that might make sense from a survival standpoint, as you might guess. That is going to exact a pretty significant toll emotionally and psychologically. And since trauma, tragic though it may be, is for the most part not super common, relatively low probability event, it's going to cause problems for somebody to be out there in the world thinking that danger is lurking around every corner. And so what we try to do is get people to a place where they can be appropriately guarded and cautious. There's nothing wrong with that, but they're not like super hyper vigilant and on edge everywhere, and that is going to be something that's going to be helpful for them emotionally and psychologically. How does studying psychology help with understanding people? So this is the best thing about psychology. Everybody that you know of, all of us, we are natural social psychologists, and what I mean by that is we all have curiosities about human behavior. We have a lot of the same sorts of questions. What kind of things are going to facilitate friendship formation? What kind of things are important in intimate partnerships? What is personality? How does personality develop? What's the right kind of parenting? What kinds of things can help us when we're feeling anxious or when we're feeling depressed? These are all questions that all of us have at one point or another. And the thing that I think is really great about psychology is we have people studying empirically and making inroads into those natural questions about human behavior that we have. And so pretty much anything that you're curious about in terms of the human condition and well-being, psychology has answers to those questions. Now, we might not have definitive answers, we might not have universal answers. Human behavior is highly variable, but we've made significant strides in answering a lot of the questions that people want to know about. What is the most surprising fact about psychology? Here's the thing that's a little bit frustrating about psychology is that if we tell people about studies in psychology and we tell them what the findings are, everything is super obvious with the benefit of hindsight. We all have this natural tendency to think that like, oh yeah, well that totally makes sense. And the reason that we do that is because human behavior is highly variable. And so whenever you find out what the answer is that psychologists have found, you can kind of search your memory banks and think of examples that fit that, and you're like, oh yeah, that makes sense. That's totally obvious. But the truth of the matter is, for a lot of the studies that psychologists engage in, people's guesses about what would happen are all over the map. I do this in my general psychology class. Sometimes I'll describe the method and what the researchers were trying to study, and I'll ask people what they think the outcome is going to be, and the accuracy of those guesses pretty low. People are, again, kind of all over the map. One would be the bystander effect, and that is, I think intuitively people think, if I was in danger, if I was in trouble, if something bad was happening to me, would it be better if there was one person standing nearby, or would it be better if there were like 5 or 6 or 7 people standing nearby? And intuitively we might think like, oh, the more people around, the greater likelihood there is that I'm going to get help. And research consistently affirms the opposite, that actually there's this thing called diffusion of responsibility. Everyone's looking for somebody else to respond. Everybody's looking for somebody else to like interpret the situation and figure out whether and how to help. And then a lot of times in those situations, help is not forthcoming. Whereas if there's one person on the scene, they have a lot more perceived personal responsibility. Good prevention programs actually educate people about this and help people take greater responsibility for acting in those situations. Why do I study psychology? I think that I am really interested in psychology and became interested in psychology as a college student because it is the science, the field that seeks to shed light on and provide answers for many of those things that we're naturally curious about regarding the human condition, regarding like well-being, regarding emotional distress and emotional wellness. And so I think it's just really fascinating to be able to unpack some of those questions and look at some of the research findings. I teach the death and dying class here in the psychology department, and as I've already mentioned, I study traumatic stress, really terrible things that can happen to people and impacts of those things. and I think people's assumption might be because those are areas of interest of mine that I am hopelessly depressed and pessimistic. It's actually quite the opposite. Those are important topics. They're things that I think that we need to know about, and if anything, working with those populations and studying those sorts of things gives you a great deal of perspective. It sort of helps you put your own frustrations and trials and tribulations in context when you recognize some of the other things that are happening to folks out there. What is the benefit of a trauma treatment clinic for trauma survivors? I think it's critically important that whatever difficulties somebody's struggling with, emotionally, psychologically, or otherwise, that there is help that is readily available and that there is help that is affordable. My treatment clinic, the trauma treatment clinic, is housed within the psychology center. And so all of the cases that I see, all the presentations that I see are related to trauma and traumatic stress. And as we've already talked about, some of the things that people will do intuitively to cope with really difficult traumatic experiences, unfortunately, are not helpful and may in fact be harmful. So it's not uncommon to see people try to avoid thinking about it, try to avoid talking about it. They'll socially withdraw, they'll isolate. And so having on-campus, low-cost services that are evidence-based, that are going to help people understand maybe why they're engaging in maladaptive coping behaviors and provide some suggestions and some guidance for how to get to a better place where trauma recovery is concerned and what things are going to be helpful, I think is critically important. What is Green Dot and what is the benefit it brings to our campus? Things like sexual assault, domestic violence, partner violence are more common than we might like to think, and historically there haven't been great prevention programs. And so Green Dot is the first program in the context of a lot of national research studies that demonstrated that it could actually reduce the rates of power-based interpersonal violence, things like sexual assault, intimate partner violence, stalking, those sorts of things. And we, fortunately, with support from trustees and administrators, were able to fund training for the Green Dot program. We brought it here to UW, and we've actually seen in just a few years that it's been implemented that we actually have reduced rates of all of those types of experiences. So Green Dot is a bystander intervention program that is designed and seems to be working in making our campus community a safer place, a safer community. If we're honest, it's hard to intervene in situations where we think something bad might happen to somebody else, because a lot of times we have personal barriers that make it difficult for us to figure out how to intervene. A lot of times we're not sure what courses of action are available to us that might facilitate us recognizing that this is a problematic situation and something bad could happen. And so a lot of times, again, in thinking about that bystander effect that I described earlier, people might hope or assume that somebody else is going to prevent it or somebody else is going to stop it. So what Green Dot does is it gives students an opportunity to understand why it's important for all of us to take ownership over collective campus safety, why this is something we should all care about. It does a much better job than previous programs in helping people recognize what their own barriers are and what things are going to make it difficult for them to step up and intervene in a situation that might feel a little bit risky. And it gives them lots of opportunity to identify and practice skills to intervene in different ways that are going to be okay in spite of their barriers. And when we give people really good intensive training like this, and we have enough of campus involved in taking ownership over those types of experiences, we can, and in fact we do, see those rates of adversity and violence go down.